Hey guys, so today we're going to talk a little bit about peptides. Peptides are small proteins that are typically found in serums. This is a type of topical skincare product. So if you've watched any of the other videos, you know we typically like to divide these products into ingredients into 6 different categories. So we have cleansers, moisturizers, sunscreens, we have antioxidants, we have vitamin A's, which are the retinols or retinoids, and we have peptides. So peptides, you know, if you think about it, you have millions of cells in the body, and each cell communicates to the other cells, typically with tiny proteins called peptides. So, you know, one cell may be signaling to another, hey, we need to increase our production of collagen or elastin, or we need to, you know, increase cell turnover. We need to regenerate or rejuvenate. And so the scientists, clinical scientists in the lab have been able to formulate these tiny peptides which mimic or simulate what the cells in the body are already doing. So this is kind of the latest and greatest technology when it comes to topical skincare products. And so, you know, typically these can get a little pricey. We carry several different ones. One is called Total Strength Serum. This is by a company called PCA. And this has a proprietary blend of several small peptides. So that's a really good one. They also carry a second one, and together this is called like the Power Couple or Incredible Duo, or you know, they named it something like that. But this is X-Linea. This is another really good one. It has several small peptides in it. Perhaps the most I think ingenious one is a small neuropeptide. So the neuropeptides are one of the latest peptides that they've been able to discover, and so there's a little early data. I don't want to, you know, lay any big claims about this yet, just because the data is so new. But they think if you're using a neuromodulator, neuromodulators are things like injections of Botox or Xeomin or Dysport. They think that by using a topical neuropeptide, that you can potentially prolong the action of like a Botox. So the Botox basically lasts a little bit longer. So again, that data is pretty new and early, so I don't want to, you know, lay too much claim to it, but it potentially is pretty exciting. So these are two, you know, really good peptides. We also carry a third. This is by a company called Neocutis. This is called the Bio Serum. It's an intensive spot treatment. It comes in a little, basically, pen applicator, so you twist the bottom, and then you can apply it to, you know, the area of concern, wherever the wrinkles are for you. I think if you look at the scientific literature, the things that have been published by this company, they call their technology PSP, which is basically processed skin protein. So they actually have taken many cells in culture and have done a great job at isolating some of the peptides. So I think that Neocutis has some really good, you know, exciting data on their peptides. Now, you may have heard in the in the news, you may have heard these peptides called, you know, stem cells. They're not really stem cells, but they are small proteins that basically mimic what stem cell action could do. You may have also heard them called cytokines or serum cytokines or growth factors. These are all terms that have kind of been thrown around. You can basically all clump those together into peptides, which are small proteins, again, cell-to-cell signaling type molecules. So these are, I think, 3 really good products. You know, when you're looking at your budget and deciding what you want to invest in topical skincare, really you want to make sure you're hitting all 5 of those other categories really well. Even though this is one of the most exciting categories, you know, we know that we have, you know, really good data in some of the other stuff. So, you know, you really want to make sure you're using a good cleanser, moisturizer, sunscreen, again, antioxidants, and the vitamin A's, which are retinols or retinoids. Once you're hitting all those, you know, I would suggest moving on to the 6th category and using it in combination with those.